Hello friends, myself Akshay Swami. I am from Asansol, West Bengal. Now let us talk about general pathology of homeopathy. So I would like to start here with the theory of chronic diseases. Human pathology is the science which treats of diseased or abnormal conditions of living human beings. It is customary to divide the subject into general pathology and special pathology. Special pathology is divided into medical pathology dealing with internal morbid conditions and surgical pathology which deals with external conditions. General pathology bears the same relation to special pathology that philosophy bears to the special sciences. It is the synthesis of the analysis made by special pathology. It deals with principles, theories, explanations and classification of facts. While the findings and conclusions of modern pathology are accepted in large part by all schools of medicine and serve as the common basis of therapeutic art, there are enough variations and differences, particularly in general pathology, arising from contemplation of the subject from the homeopathic point of view to justify the creation of a special field or department called homeopathic general pathology, especially as it is concerned with the chronic diseases. Homeopathic medical science views the facts of the universe in general and medical facts in particular from a vitalistic substantialistic standpoint, that is, from the standpoint of the substantial philosophy which regards all things and forces, including life and mind, as substantial entities having a real objective existence. In homeopathic philosophy, life and mind are the fundamental verities of the universe. In formulating Dr. Hahnemann's theory of the chronic miasms, Hahnemann did for pathology what he had already done for therapeutics. He reduced a great mass of unsystematized data to order by making a classification based upon general principles. This classification of the phenomena of disease led to the broadest generalization in pathology and etiology that has ever been made, and greatly simplified and elucidated the whole subject. Hahnemann began to blaze his way, guided by the compass of logic, encased in the inductive method of Bacon. His search was now directed to the discovery of the fundamental causes of the non-venereal diseases. Having found that so large a number of symptoms and diseases had a venereal origin in syphilis and psychosis, it occurred to him that it might be possible to find a common general or primary cause for all or at least a greater part of the remaining symptoms of disease, and thus to make a final generalization. To this end, he directed his efforts. Rejecting existing classifications, he searched, collected, compared, grouped similar and naturally related symptoms in the light of history, logic and experience, tracing the relations between similar diseases and their antecedents, and tracing recognized proximate cause to their antecedent causes as far back as possible. He gradually narrowed the field of general causation until he arrived at one primary cause which accounted for and explained the greater part, if not all, of the phenomena with which he was working. The determination of a primary cause opened the way for a consistent reclassification of the secondary causes and the correction of many errors of grouping and nomenclature of diseases. It obliterated at one stroke a large number of fictitious diseases which were in reality named from merely single symptoms. Bacteriology pointed out first that we have inherited from preceding generations a false and misleading interpretation of what Hahnemann really taught in regard to SORA as the cause of chronic non-venereal diseases. When we are talking about these diseases, we have to know the doctrine of latency. What is it? Hahnemann taught that SORA, like syphilis and psychosis, may remain latent for long periods until circumstances awaken the disease slumbering within and thus develop its germs. This doctrine of latency was strenuously opposed for a long time, but is now endorsed and taught by the highest authorities in regard to syphilis, gonorrhea, and tuberculosis. Individualization is the cardinal principle of a true pathology as well as of a true therapeutics. In the eager quest for the specific bacterial causes of the various diseases, the principles of logic have not always been applied. and particularly that principle known as the law of causation, which teaches that every effect has a number of causes, of which the specific cause is only the proximate or most nearly related to the preceding series. It also teaches that the specific cause may be modified in its action on the subject by collateral causes or conditions affecting both the subject and the antecedent causes, so that no specific cause can be said to act unconditionally. Homeopathy is based essentially upon the law of antidotes, which is found by observation, experiment, and clinical demonstration to be the law of mutual action or attraction, expressing the equality and contrariety of action and reaction as manifested in the living organism by similarity of symptoms and resulting in physiological and chemical assimilation or neutralization. Antidotes are commonly divided into three classes according to their mode of action: physiological or dynamical, chemical, and mechanical. So, this was all about general pathology of homeopathy. Now, after understanding this general pathology of homeopathy, we have to understand what is symptomatology. Well, the first requisite to correct understanding of the subject of symptomatology is to know the full meaning of the word symptom and all that it involves. Knowledge of the true nature and constitution of a symptom is necessary in proving or testing medicines, in the examination of a patient, in the study of materia medica, and in the selection and management of the indicated remedy. It is a standard by which we judge the reliability of approving a clinical case, an examination record, or the profession of a new coming conferor. Ignorance of the nature and constitution of symptoms on the part of provers, directors of provings, and physicians has resulted in the production of certain provings and books on materia medica, which are practically worthless, and the publication of reports of cases which have served no better purpose than to float the authors' names on the sea of printers' ink. Such productions, consisting largely of commonplace generalities, indefinite pathological names, and pseudoscientific instrumental and laboratory findings, reveal the ignorance of their authors of that goes into the making of reliable cures and provings conducted under classic homeopathic principles. Hahnemann defines symptoms broadly as any manifestation of a deviation from a former state of health perceptible by the patient, the individuals around him, or the physician. We have here the basis of the common division of symptoms into two general classes: subjective and objective. Subjective symptoms. Subjective symptoms are symptoms which are discoverable by the patient alone, such as pain and other morbid sensations of body or mind, presenting no external indications. With Hahnemann's announcement of the doctrine of the totality of the symptoms as the basis of the homeopathic prescription, it became possible for the first time in the history of medicine to utilize all the phenomena of disease. Under the new system of therapeutics devised by Hahnemann, subjective symptoms naturally took their proper place in the study of the case as expressions of the interior states of the organism, and particularly of the psychic and mental states. They take the highest rank. Nothing can supersede them. They constitute the only direct avenue of approach to that inner sphere which must otherwise remain closed to our investigation, except as it is indirectly revealed in certain automatic or involuntary objective symptoms from which more or less accurate deductions can sometimes be made. They enable the physician to view disease from the standpoint of the patient. How great an advantage, therefore, to the prescriber can be appreciated only when we are deprived of them, as in the case of infants and animals, and find how much more difficult is our task under such circumstances. Objective symptoms. Hahnemann defines objective symptoms as the expression of disease in the sensations and functions of that side of the organism exposed to the senses of the physician and bystanders. In this peculiar definition, there is an allusion in his definition of disease as a dynamical disturbance of the vital force, and of medicine as a pure science of experience, which can and must rest on clear facts and sensible phenomena clearly cognizable by the senses. There is also a reminder that there is more in an objective symptom than is perceptible to the eye alone. The subjective sensations and functions of the visibly affected organ or part are to be considered as well as purely objective signs. Totality of the symptoms. Now, what is this totality that we have been talking about? Totality of the symptoms is an expression peculiar to homeopathy, which requires special attention. It is highly important to understand exactly what it means and involves, because the totality of the symptoms is the true and only basis for every homeopathic prescription. Hahnemann says in 6th aphorism of Organon, the ensemble or totality of these available signs or symptoms represents in its full extent the disease itself. That is, they constitute the true and only form of which the mind is capable of conceiving. The expression has a twofold meaning. It represents the disease and it also represents the remedy, as language represents thought. The totality of the symptoms means, first, the totality of each individual symptom. A single symptom is more than a single fact. It is a fact with its history, its origin, its location, its progress or direction, and its conditions. Now let's take a note about characteristics and keynotes. In paragraph 153 of the Organon, Hahnemann says that in comparing the collective symptoms of the natural disease with drug symptoms for the purpose of finding the specific curative remedy, the more striking, singular, uncommon, and peculiar characteristic signs and symptoms of the case are chiefly and almost solely to be kept in view. For it is more particularly these that very similar ones in the list of symptoms of the selected medicine must correspond to, in order to constitute it the most suitable for effecting the cure. The more general and undefined symptoms, like loss of appetite, headache, debility, etc., demand but little attention. When of that vague and indefinite character, if they cannot be more accurately described as symptoms of such a general nature, are observed in almost every disease and drug. This seems a sufficiently clear description of what Hahnemann meant by characteristic symptoms. And yet the term has been the subject of much discussion and many have differed as to what constitutes a characteristic. Dr. P.P. Wells says, characteristic symptoms are those which individualize both the disease and the drug. That which distinguishes the individual case of disease to be treated from other members of its class is to find its resemblance among those effects of the drug which distinguish it from other drugs. This is what we mean when we say that with these the law of cure has chiefly to do. When we say like cures like, this is the like we mean. Thanks a lot for patient listening to my module.